Test 1 2, test 1 2. Test 1 3, test 1 3.
Let's go ahead and call to order the board meeting for today, August the September. Thank you. I'm on the wrong page here. Our board meeting for September the 8th, 2022. Leanne, come forward. Okay.
Together this afternoon. I'm aware that it feels a little cooler outside, and 2 weeks from today is going to be the first day of fall, the changing of the seasons. This month, we're also ending our fiscal year. Lots of change. But what isn't changing is our commitment to our patients and to the communities we serve. What isn't changing is our trust in and support for our board members and our leaders who are effecting these good changes. What isn't changing is our commitment to serve together for the good of all. And so, God, we thank you for your wisdom, your strength, and your courage to create the change needed for this changing landscape of healthcare. In your holy name we pray. Amen.
Amen. All right. Pledge allegiance.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Do we have any citizen wishing to address the board? Okay. Next on our agenda is the approval of our August 11th minutes. Are there any corrections? Okay. Second? Okay. Motion by Ralph, second by Steve Montgomery. All those in favor for approving the minutes signify by saying aye. Aye. Those approval by nay. Motion is approved unanimously. I do not have a report today, so we will go into Dr. Duncan's.
Okay, thank you, and good afternoon. Everybody's so quiet. The hospital continues to be very busy with admissions, and I do want to thank the staff for just their commitment and hard work every day in caring for our patients, and I know the board has always thanked the staff, but I personally would like to thank them because it has been truly busy here, and they've done an amazing job. So thanks to our staff and to our physicians. We will start to enter into flu season, and so we will have flu vaccine available for employees, for physicians, and for our board members soon, along with the booster COVID vaccine. And so we'll have that soon and available for everyone. I do want to call attention, as always, we continue to have a lot of great quality going on across the hospital, and I would like to call attention to the fact that JPS will be featured in the U.S. News and World Report as one of the best hospitals for its achievement and participation in what's called Own the Bone Quality Improvement Program, and like to thank our orthopedics program. So again, being recognized across the nation for the great quality work that goes on. I also would like to mention that JPS will be partnering with the City of Fort Worth Como Community Center for a health and wellness program kickoff fair in September. There's been a lot of effort behind the scene for that partnership, and it's coming to fruition. And there will be a lot of education classes during that fair around heart failure, COVID-19, living with diabetes, high blood pressure, smoking cessation, outpatient behavioral health. So again, community outreach in one of our big communities here. We have 2 board members that will be recognized over the next couple of months. I did mention last time Chairwoman Dorothy Debose, who will be recognized October 21st as the Kearney Leday Senior Trustee of the Year. That's given by the Dallas-Fort Worth Hospital Council. And so looking forward to that. And then also, Amanda Arizola will be recognized in September 15th, is it? Okay. She will receive the Latina Living Legend and Ella Award. Tried to say that several times. And she is being recognized for her lifetime commitment as a Dallas-Fort Worth area Latina who has distinguished herself through her profession, active community, and civic participation, volunteerism, and other philanthropic endeavors directly benefiting the community at large. So thanks to both of you for your recognition. Other updates. I had the opportunity to sit down with Congresswoman Kay Granger while she was in town here at Fort Worth. She voiced a lot of support for JPS, and so I had the opportunity to not only share some of the challenges we face as a safety net hospital here in Fort Worth, but also really to speak of the great work that's going on here in Fort Worth. And her last comment was, I really do want to help you, so I'm looking forward to continue meetings. But great meeting, and I appreciate the fact that she gave of her time. We presented, Sharon actually presented at Commissioner's Court on Tuesday, an overview of the budget that will move for final approval next Tuesday at Commissioner's Court. And so I wanted to let you know that. And we have an engagement survey, both for our clinicians and our employees, that's coming up September 19th through October 2nd. This is the annual engagement survey that will roll out. Regarding some of the executive team, I did send an update to board members, but David Mendenhall is no longer with JPS, and Will Showalter, our CIO, will be taking over all of those areas of information and technology. Dr. Stevenson, who has headed our quality committee, has decided to go back into clinical full-time, and so he will be stepping down as vice president over quality here at the hospital. Jen Fondon, who is the executive director who has served under Dr. Stevenson, will step in to help with those duties. And also, as many of you know, Lauren has left, and it's left me a little bit confused at times because she really was keeping me on point. But I did want to introduce Nisha Patel. Nisha, if you can just raise your hand. She served under Lauren, and so you will hear or see her from time to time as she helps coordinate, especially a lot of the board activities and ensuring that you have your talking points for your committee updates. So I did want to introduce her. Last update, if I can ask Wanda Peebles to approach. Hi, Wanda. As mentioned previously, and this is the hardest for me to do, Wanda Peebles will be retiring at the end of this month. And just to remind you a little bit about Wanda, she serves as our chief nurse executive. She joined JPS in 2010. She came here as a consultant to share her expertise in with our surgical services, and was quickly recognized both not only for her operational strength, but just her leadership abilities. And she was named as vice president in 2011, so within about a year of being here. And then in 2012, stepped in as our CNO. So she's been here for over 10 years, has watched JPS go through a lot. I could go on really for this full meeting about all the accomplishments that Wanda has had here at JPS. I think she is most noted by her team. If you round on the floors, you often will see her picture on the floors with her team. That's how important her team feels she is. And they all know her. They especially look forward to each year in which she brings them ice cream. I can tell you that is the most exciting event here at JPS. And she leads that along with all her other leadership. She was instrumental in helping to bring up the Level 1 Trauma Center. She has completely restructured nursing leadership by implementing a shared governance structure. She achieved Pathways to Excellence designation, and she developed a nurse residency program, which has really helped us with this shortage that we've had with nursing. And she actually then went on to help us achieve the ANCC accreditation. She successfully implemented the conversion to Epic. I mean, huge work. And she moved our patient experience scores when she started here from single digits to the top quartile. She has received a lot of recognition in a lot of nursing arenas, and she has led our team, not just the nursing team, but she has led us through a pandemic, which I really want to thank her for. And then also some of our, in what we consider to be internal disasters, those ice storms. And so without Wanda really leading the way, we probably still would be chipping away at ice right now. She has, you've always heard of the quality accreditations and reaccreditation programs. That really has come from our nursing area, and Wanda has led all of that and supported all of that. She has successfully led 3 joint commission surveys, and that's huge, and I told her to keep her phone on, because we will need her for all future ones. She received the 2012 Nursing Leader of the Year Award, and she has been recognized in the Dallas-Fort Worth Great 100 Nursing Program. Again, I cannot say enough about Wanda. She has been an amazing executive and leader, and she's not only been a great colleague of mine, but she's also been a great friend. So we can thank her.
Well, Wanda, from one chief nursing officer to another, and you did a magnificent job.
Okay, Wanda, we're going to put you on the spot now.
Well, thank you all. I just want to say I cannot thank you enough for the support that I've had from this board. I'm not going to get there. If anybody knows me, they know I'm a crier. And so when something really, truly means something to me, and it's been an honor and a pleasure to serve as the chief nurse in this organization. And like I said, I truly appreciate the support you've given me. Several of you came into my office even early on and said, if you need anything, you come to us. We'll make sure you have what you need. Dorothy, I can't thank you enough for your support for nursing and for me personally. And you've been a great inspiration for me and a great support for making sure nursing was always well represented and at the table when decisions were being made, and I thank you for that. It's going to be hard to leave, but it's time for the next chapter in my life. My husband's been retired 10 years and been wanting me to retire, so who knows, I may be back in some capacity because we've never been together that long or that much. So I've done this 47 years, and we've not spent that much quality time together. But I'm looking forward to it, and we'll have a great time. And so again, thank you. It's been a wild ride, I will say. It's been I've been cleaning out my office for the last couple of days and going through things to hand over to Jill. And so it's been a walk down memory lane to see all the things we've done, the Joint Commission surveys, the Pathways to Excellence, the awards we've received, and then some of the struggles we've had. So, like I said, it's been an amazing experience, and thank you so much. So, thank you. I appreciate it.
Thank you, Wanda.
Thank you.
We'll have a lot of retirement activities going on. Look for some of those invitations, but it's going to be hard not to see Wanda as I turn that corner every morning.
Hold on just 1 minute.
Madam Chair, I just want to mention, years ago, Trent and I sat at the nurses program, honoring the nurses, and kind of an unheard thing. We would sit there in amazement that they gave her the Nurse of the Year award, and she had just started here at JPS. So I thought that was awesome.
Thank you, Reverend Emerson. I appreciate that.
All right.
Thank you all.
Thank you, Wanda. Okay. I still have your number, so I'll call you.
I'll count on that.
All right, okay. That concludes your report.
Yes, I'm sorry, got caught up in Wanda. Could not, yeah.
Okay.
Yes, that concludes my update.
Next on the agenda is Dr. Miles for the clinical privilege forms.
Thank you, Madam Chair. Just a quick few minutes for an update from the medical staff on our activities. We did want to bring forward an update on the delineation of privilege project. As you know, this is a very large project we've been working on for quite some time. There are approximately 72% of the privilege forms that are either completed or in process at this time. So there's roughly 28%. I think that works out to be about 19 that we have not yet started. Some of those we will not need to start because we have already incorporated them into other in-process documents. So we do feel that we're on track to meet the first quarter 2023 goal for completion of this project. I did want to let you know that APP Week is coming up. It's the last week in September, September 26th to the 30th. We acknowledge and recognize our advanced practice providers. And remember, those are all of our nurse practitioners, our CRNAs, all of our physician extenders. So we'll have a week-long celebration for them, modeled very similarly to what we have already done for Doctors Week this year. And finally, the medical staff is deeply engaged in additional revisions of documents. We are undergoing our annual review of the bylaws. This is something that's a little new to the board because previously we passed the bylaws and didn't look at them for 10 years. And generally that's not the best strategy moving forward to stay current in your bylaws. So we are undergoing annual review of those. If there are any changes, they will come back to the board for approval. So that's just a little taste of something to come. And then we obviously are doing a lot of reviews around our policies and procedures that support our bylaws. So a lot of our committees have a lot of activities going on. Okay, thank you for your patience for that short update. The real business on the agenda today is on page 10. And that is the delineation of privilege form for the women's health nurse practitioner. The majority of the changes you will find on page 11, where there is a significant number of procedures that were inserted into the privilege form. The reason for that methodology is we want to be very clear what procedures a nurse practitioner can do in women's health. And so we wanted to make it very clear that this is what we approve for them to do on their own. I think that was the majority of the cleanup for this particular policy. So I submit it to you for approval.
All right. Are there any questions of Dr. Miles on the privilege? Then can I get a motion for approval? All right. Ralph, second by Jim. All those in favor of the approval signify by saying aye. Those opposed by nay. DT told me he's on his way, so Amanda, I will let you. Yeah, you got a mouthful, so sorry. Okay.
So HR committee review, we talked about the healthcare landscape, already in presentation regarding the resignations that continue to be a current challenge for the hospital and why healthcare workers are leaving the profession for various reasons. Premium pay, overtime incentives, contract labor has all risen. And in order to reduce premium pay, and focus must continue to be on recruitment and retention. So we had a good discussion regarding that. Diversity, equity, and inclusion and belonging, DEEB. JPS continues to partner with Canaries to develop a strong DEIB organizational program, and data continues to be collected and will be shared with the board as we move forward. Employee engagement. So the last employee engagement survey results identified a couple of things. So it's identified their core strengths as being partnership and collaboration within teams. And core opportunities include recognition, feedback, and value. The clinician and employee engagement survey will begin September 19th and go through October 2nd. And then finally, the new employee benefits for the upcoming year, things that we talked about during budgeting, not all of them, but some of the things that are coming up is We Care, and that's WEE, so for the little tiny ones. It's home-based childcare with discounted rate for employees. ComPsych, which is confidential emotional support, legal guidance and financial resources, and terms-based exchange TBX decision tool that will help employees understand their health benefits and what healthcare coverage looks like. So those 3 things are going to be added in within this next year. And that's kind of what we talked about during our HR committee meeting.
Okay.
Thank you.
All right, thank you. Any questions for Amanda? All right. I think I'll just get DT's report and give it for him. Okay. And all right. Thank you. Okay. No. Okay. The Finance Committee met in July. Their total operating revenue was under budget by 1%, and total operating expenses were over by 6%. For the month of July, the following areas had a exceeded budget: was urgent care and outpatient, medical, surgical admission, inpatient surgeries, primary care visits, specialty visits. Emergency visits were below budget, and case mix remained higher than budget. It was noted that the retail pharmacy revenue was favorable to budget by 24%, which is great due to the volume in the specialty pharmacy. Purchase services was below budget, supplies were favorable. The connection enrollment, they had new members of 2,682, and we termed 2,807, so lost a few more than we gained. The total operating revenue was above budget by 4%, and total operating expense were favorable to budget by 3%. Payer incentive receipts were above budget this month compared to last month when they were lower than budget. A total of 11 contracts were presented and approved, which are listed on the current agenda for today. That's it. Any questions of DT? Yes.
I should have asked it earlier. How Dr. Duncan or Karen felt after the presentation last Tuesday or this Tuesday on the budget, how you felt us going into next Tuesday for approval.
Yes. So Sharon and I had the opportunity prior to the Tuesday meeting to meet with each member of the court prior to that meeting and to review the presentation, but also to be able to answer any questions they may have about how we worked with the board to come up with this year's budget. And so as a result, the presentation went fairly smooth. I mean, I would say Dorothy was actually there and DT were there, but I thought that it went with very little, a few questions that we were not able to answer. So with that said, I would anticipate that there would not be much further discussion next Tuesday and that it should get passed without any problem.
That was my consensus, that it went very well, that they didn't have any questions or it was smooth to me, that I didn't see or pick up anything that there were any concerns about it. I think the pre-meeting really worked, and they was complimentary to the hospital district. Yeah. Okay. All right. Next, we have ratification of the statement of work between Hill-Rom and Tarrant County Hospital District. You want to handle that?
Yes, ma'am. Thank you. So the hospital was experiencing challenges with its nurse call system last month, and as a result, we had requested from the officers to move forward with spend that was already approved as a budgeted item. So we requested from the officers to approve statements of work with Hill-Rom, which is a Vizient vendor for us to install the new nurse call system, and the spends respectively were $1.9 million and $3.2 million. The officers did give us that approval to move forward, so we're now seeking ratification of that approval from the board.
Are there any questions?
Yeah, just,
Yes.
so Daphne, we didn't realize it was going to crash as fast as it did? Is that the bottom line? Because we're having to do this through an emergency order, and it was budgeted, so we just didn't know it was going to go this fast?
Yeah, we had already planned to purchase the equipment, but what ended up happening is that there was a crash, and so it was causing significant system issues, like we had to get people at the bedside to serve as runners to answer people's needs, and had, what do you call those little bells? The bells that you actually ring like this for us to call. And so I think that we already knew that the system was outdated and had planned to purchase it. I don't think we were expecting that level of crash. I see Bill coming up here, so I must not be doing the best job answering your question.
So, Bill, were we able to do the level of research and the work on vendors and all of the other aspects of the research before we made the call on this?
Yes, and what exacerbated it was not just a crash out of nowhere. There was a lightning strike that occurred, and the system went down after the lightning strike, and then it kept coming up intermittently in different areas. So we started up our incident command center. Wanda was instrumental in helping us lead our incident command center and making sure that all our patients were taken care of. And even to this day, right now, we still have 5 individuals, full FTEs, that are helping monitor the systems. So that's really what started it.
All right,
but it was always planned to be replaced next year.
Okay, thank you, sir.
Yeah, Trent, we had started working on this last year knowing that we were having a hard time servicing when it went down, and so it had gone through its RFP, and the plan was to get it started actually before we even started new hospital build, because we knew it couldn't last.
Okay. I gave you a report, DT. That's
You were fantastic. You were actually standing out.
all right. So can I get a motion for the ratification of the statement of work? Okay. Trent, second by. All those in favor of approving the statement of work signify by saying aye. Those approved by nay. Motion passes unanimous. Next on our agenda is a presentation from the foundation. Cheryl Shatterfield. Come on down.
Thank you.
Okay.
Thank you for letting me be here. I have been looking forward to it and appreciate the opportunity. I really have appreciated getting to meet a lot of you. Thank you for coming by the foundation, spending time. I appreciate your candor, your insight, but most of all, your pledge of support. And I know we're going to do great things together. So I've had a great time getting started and getting up and running. Now, y'all noticed at the last board meeting, somebody stated that the foundation was in its infancy. And I do appreciate that, and we are. I think you recognize that. I certainly recognize it. But I will tell you, we are crawling today. We have progressed. We are at least beginning to crawl, and it won't be long till we're walking and soon running. So stay tuned. We're going to grow up really quick here and do some great things. So today I really would just want to bring a high-level overview of what we're doing. I think what you can expect from the foundation moving forward. So just kind of a high-level conversation, and certainly I know you'll have questions too. Let's see if I can get this to work. Uh-oh. All right, Suzanne, you told me I just had to push the button. Well, you've got, oh, there it is. Okay, we got it. Yeah. Is it there? Well, you have it in front of you, so that's fine. I can do without it. Y'all can look at it. Is that it? No? Not going anywhere. That's okay. Let's just move on. Y'all have it in front of you. You've looked at it, and believe me, I've looked at it, so we're good. One of the things that I do want to talk about is that the foundation and what we're working on right now is creating a comprehensive, robust, diversified fundraising strategy. And when you look at the list, I'll try that again. I think it's there. No. Am I hitting the wrong buttons? It's me. Thank you. See, I did need technology help. That one? going to keep pushing buttons. There we go. Yay. All right. Passed my first test. Thank you. You know, when you look at the list of everything that a strong development department encompasses, we need to be really strategic and be sure we've got the full complement of what we can do in a development department. And one of the mistakes we all make is we'll pick one and we'll go, oh, we just want to do that. You know, let's do this, let's do an event, or let's just do major giving. We have to be sure we're encompassing everything as we move through and that we truly have the full complement. So we're going to be working, and you'll be seeing as we grow that we're encompassing everything because it all has to work together. All these strategies totally work together. You can't just pick one. Now, I keep looking for the easy button. I've been looking for 30 years, and there is no easy button to fundraising. It's hard work. It takes strategy. It's science and it's art. But we can truly come together and do all of these things. And with a really strong moves management program, which we will have, we'll bring people in the door. They'll make a donation. They'll love us, but that doesn't stop. Then we want to move them through the cycle. We want to embrace them and bring them in to be a major gift donor. And ultimately, you lead to that final legacy gift or planned giving. And so that's our goal, is to work people all the way through this whole strategy that we'll be implementing and putting forth. So the big thing is we'll be looking at all of it, we'll be implementing, but we'll be strategic about what we do and when we do it. And when we do this right, the beauty of it is that we get the right gift at the right time for the greatest joy of the donor. And that's kind of my mantra in fundraising. If we don't bring joy to the donor when they give, they're not going to come back. And so we want to be sure they give a joyful gift. There is no strong arming when you come to fundraising. So we'll get that greatest joy. I do want to point out and talk about the event. So in talking to all of you and in coming on board, the tent event. I keep hearing about the famous tent event that y'all had in 2016 and 2017. And so the curiosity got the best of me, and I went back and did some research on the event. So the event is actually a very proven, successful fundraising method. It's called the Benavon model, and I have used it often, not in a tent, but I have done the model, and it is a great model. But what you'll hear me say, and our consultant later that I learned from Panis and Associates, 90% of the work of fundraising is done before you ever make an ask. And so when you have an event, the event does not draw the money. The event, when you make money from an event, you've done all the pre-work to get up to a successful event. Following that event, you're following up with everybody and keeping that cycle going. So it's real important that if you're going to do an event, especially like the Benavon event, that you're truly implementing it from A to Z to get the full success out of that. So I did go back and look at the P&L. And you did make $228,000. That was the 2 years combined, the combined P&L from 2016 and 2017. You made $228,000. You had about a 36% ROI. You didn't go under, but that's not great. Looking forward, that kind of event would continue to grow. It's the kind of event that would grow year after year if you implemented the full, process of that event. But what I'd be more curious, and I will be looking at, is what happened to those 800 people? How many of those 800 people did we pull in to become annual donors? How many of those people have we moved to a major gift category? I think I'll find that we probably didn't do that, but that's the beauty of an event like that. So again, the strategy when you move forward is critical. You can't just pick out one piece. So this is what we're going to be working on and what you'll see, from the foundation as we move forward. Events are expensive. I never like to have an RI under 50%, and that's only if you're bringing in like $1 million, because events are hard work. So you have to be sure you've got the ROI to sustain and support that event. So we'll be strategic as we implement the different fundraising campaigns and move forward and just ensure that we've got continuous quality growth. That's my goal right now. I don't want to just throw something out there. We could probably go raise a quick $100,000, but that wouldn't benefit us if we don't do it strategically and work through the process. So my vision, and I shared with some of you who were on the search committee when I came forward, the vision I had that I shared at that I don't know, one of the many interviews I had, was that I believed that JPS Foundation could be a significant piece of JPS Hospital. We should be providing significant funds. And you know, my passion is even greater today because I know we can, and I know the potential is there. So my goal is that we're going to be a significant piece of what JPS needs when we fill gaps. And I told Sharon the other day that I'll know we have arrived when I can be a piece of the budget. Your pie chart, I'd love to see foundation on it. And look, yeah, maybe that takes 40 million, and maybe we won't ever get there. But I believe in setting high goals. But I will know that when the foundation recognizes that we're providing significance to the hospital, we'll have a strong partnership. And so that's my goal. That's what I'm working towards, and we will arrive there. The next slide, many of you have seen. If you've met with me one-on-one, you have seen a version. This is a working document. But part of what I did when I started was to be sure that we were aligning what we did, our pillars of giving, and that they aligned with the hospital strategic plan. So we took the strategic plan, divided that out, and we looked at all the areas where we believe the foundation is. Right now, we're providing support in all these areas. So you look at patients, I mean, the true north, all the things that we cover in providing patient support and patient needs. And then, of course, what we work in the community. You know, you've heard about community events already today. We're able to provide that kind of funding. And then what we do for our employees. And because of the focus this year on workforce, I think I heard Dr. Duncan say that was priority 1, 2, and 3. You're going to see a lot of areas that I've already identified that we can step in and will really provide. And I'm working with Carla right now and putting some grant proposals together for things that she needs to really succeed in that area. This will be a donor tool. I've used it already when I sit down and talk to people and say, this is how the foundation supports JPS and the community. What's your interest? Which of these, are you interested in? And then we can begin to drill down. So this will always be a moving, changing document, but it's one that will always align with the hospital. So as long as we have our pillars of giving and they're aligning with the hospital, then we're going to be able to move quickly forward with what we're doing. This year looks like, we're right at the end of the year, but looks like we'll have donated $1 million of support to JPS. Probably less, I think, than you've done in previous years, but we are in infancy and we had an inactive year really. So about $1 million. We gave $300,000 to some capital needs, which is a drop in the bucket to your capital needs, but we were able to scrounge up $300,000 to get some things that maybe weren't going to be funded otherwise. The new shuttle, really proud. We got that in time before the garage came down, so you've got the new shuttle. And then all the other ways that we provide support, again, continuing with patients and employees and scholarships that we're working forward. So I know those numbers are going to grow, and they will continue to grow, and we'll, again, be providing more funds as we move forward. But this will always be a document that will keep us, I think, in line with each other with what we do. So let me talk a minute about KPIs. I just listed some of the KPIs that we're going to be looking at and that we will put together. Right now, the foundation is building our own strategic plan. So until we get that done, which will be about mid-November, we're going to drill into these, and you'll see a dashboard when we come back that will tell you what our baseline is, what we believe is realistic growth. We'll have stretch goals, much like all the goals and dashboards you look at here. We're going to be held accountable. And what I want you to know is you'll have access to that dashboard, and we should all be monitoring the success of the foundation. But we need real goals, and I'm very goal-oriented and data-driven, so it's going to be really important as we come in and look at these, that we know how many donors we have, what's the realistic growth per year, and we work towards those. We always want to look at fundraising ROI and average gift size, so we'll be working on all of those. I'm very happy that you have one of the top-notch donor data systems. We have Razor's Edge and Blackbaud. I say that Razor's Edge does everything but ask for the money. So we can track, we can, as I get a staff, we can track their portfolios, we can track the action they're doing in it, and that will help us always develop those ROIs. So stay tuned. I didn't want to bring numbers to you today because I'm still trying to put that together, but I think by the next time I'm invited back, y'all should have a good dashboard that you can begin to look at and we can monitor and track progress on. I brought one slide, one little, things we can pull out, and I know it's one that you've looked at before and talked about, where does the money come from? So this was just one slide that I had looked at the other day, and you can really tell from, 21, the black area was foundations. But because this year our foundation was not active, we weren't raising money from the foundation area, which gives you a really slim line up there. The other thing that I want to really ensure, and when we come back and you look at numbers, is that we're pulling out anything that is not pure fundraising numbers. Right now, this is our entire budget. And, we talked last time, and I know Sharon talked in the budget planning meeting, the charitable. An example would be the about $500,000 that's in there for your charity cases that the hospital passes through. We're not raising that money, although I think that's going to be an opportunity that I think we could actually raise money for that, but we're not raising money for that. So I need to pull that out, because when you look at what the foundation is raising, I want you to hold me accountable to the dollars we're raising from the community, not pass-through money. So that will look different when we begin to look at actual donors. We count registrations. Right now, we do a lot of the registrations. If a department has a conference, we run that through the foundation. So I want to pull those out. Conference registrations should not count as a donor. I may want to make them a donor, and I hope I can, but that should not be counted as a donor. So we're going to be working on that to be sure we're really being held accountable to true fundraising and tracking the money that we're bringing in. So what are we doing right now? This is kind of where we're at, this is my working document, the things we're doing today. As I said, our strategic plan should be done about November 22nd. We'll have that, and then we'll begin building our KPIs. North Texas Giving Day has launched the early giving. Your email's probably already blowing up with North Texas Giving Day. We are ready to launch. We are good to go. If you look at the North Texas Giving Day, we are up and running, and we are mainly doing a social media drive this year. And there are a lot of things you can do with North Texas Giving Day, but I'm very cautious. I've done it for 20 years, so I'm very cautious on, you have to balance the amount of effort you put into it to the real potential of getting money. Again, it's just one of those darts you would throw, and if you don't have a strong pipeline and you haven't geared that up, you're not going to make the money from random calls. So it's a targeted ask, and we want to be more strategic in North Texas Giving Day, but I think we're going to have a good showing. We're going to look good. People are going to know we're out there. They're going to know we need the money and that it's going for a good cause to support our community. I'm really tickled that we got a $10,000 match. And for North Texas Giving Day, that's a big successor. You get more recognition on their pages, and a lot of donors will come in and look for matches. And if they see a match, that's where they will pick and put their money. So it's a dollar-to-dollar match. So any dollar comes in, it will be matched up to $10,000. So we're good to go with that, and excited about getting that launched and seeing what we do with that. We are switching up our internal campaign, so the employee and physician campaign. I think of everything that I've seen, even from the very beginning, was that this is a real opportunity for potential. And we know that it's a proven fact that employee giving increases employee morale and engagement. We know that. People give their time and they work hard, but when they give money, they feel real ownership. And so there's a real potential to grow. So we're moving that campaign this year away from benefits. And Carla has been a huge partner in helping us come up with how we're going to do it this year. So we're moving that to a standalone campaign. It will be fun. We'll have incentives, and we'll work with everybody to get excited about giving back and see what we can do with that, with both employees and physicians. So I did some math to try to set a goal. If every employee and physician gave 1 hour of pay per month, we would raise over $3 million. That's significant. Now, not everybody can do that, and we're very sensitive to that. Not everybody can even give an hour of pay. So we're not going to strong-arm anybody. What that means is some of us have to step up and fill that gap. So I'll be looking at our leadership, myself, and we'll make leadership gifts that will make a difference. Now, I do have high goals, but I'm realistic, and I don't think we're going to make $3 million. But I think we can make $1 million this year. I just believe that if we get behind this and we do it right, we can reach $1 million. My goal is to increase participation. We only have 12% participation. Right now, about 1,003. When I looked this morning, we had 1,003. We need to increase participation and get excitement around that. So I think we can do $1 million, but more than that, I think we can get that participation level up. The next thing we're working on, of course, let me get down here and see where we're at. Yay, I'm proud to announce I have 5 employees. That says 3. We hired 2 more this week. We're on a roll. We're going to get to that 11 yet. And what a great opportunity to build a team. I think we were in a meeting yesterday and talked about sometimes it's easier to train than to untrain somebody. So it's kind of fun to get to build the team and pull in some really dynamic, young, energetic fundraisers who are excited about what they're going to be able to do here. So we're at 5. We'll continue to grow and get our full team together. And when we do, we'll be able to fully implement that full strategy of fundraising tools that we have. The other thing we're looking at is the board, and as we've talked about, the foundation board needs to build back up and we need to grow. So if you have ideas of people who could come help us raise money, that's the goal. So don't give them any kind of false pretenses that it'll be fun or an easy job. We need people who believe in JPS and want to help us raise money and get out there in the community and be our advocate. And then we'll just continue as we grow the team. The things we're beginning to implement will be our stewardship. We want to implement direct mail. We've got to get those things up and running. They're just a constant way that you feed the pipeline, and we'll get all of that going. The thing that's critical right now, and you saw it both on the pillars, is the capital or comprehensive campaign and how we can support the master facility plan. And we've got a consultant here that I've been working with that's going to visit with us later to talk about some of those things, to set our reality of where we are, where we need to be, and when we can come up with the right time. Again, you go back to right time, right gift, joy of the donor. We've got to be sure we do this right. This is critical that we advance and do and approach this method. So we'll continue, and everything we're doing right now, that's just a common part of my day, is looking at ways and how and when the time is right for us to support the master facility plan. And of course, we'll continue working on stewardship and our pipeline and major gifts. All that will continue to move forward. So, last slide. Y'all have been quiet. I was prepared for questions, but I'll take them at the end. I'm going to work from the bottom up on this slide. Every Moment Matters is our theme for the year, and we wanted to kind of brand and have a theme for what we were going to do. Every Moment Matters, I think, is so powerful when you think about what JPS does, because what we do every minute does matter, and it's going to be a great way for us to begin to tell the story. We're going to be able to tell the story of different ways in every department and how that every moment matters, and then how the community can get behind and support what we do. So we're excited about that. So of course, North Texas Giving Day coming up, and with most of you, I've visited with most of you, so I think you know this is coming, but you know every nonprofit board and foundation, one of the critical things that we have is 100% board giving. When I go out and talk to donors, donors want to know that those closest to the organization are committed and are giving. And I know many of you sit on other boards, and you've done it. I've done it. They want to know that the board has given. So I had a bright idea that North Texas Giving Day would be a great day to launch board giving and to challenge y'all to to step up and help us, launch right out the door that JPS has 100% board giving. And this will apply to the foundation board as well. I'm meeting with them next week, and they expect this as well. But it will be huge for us when we go out in the community to let our donors know, not only are you giving of your time and your talent, but you're giving financially as well. So I have that ask before you today. I am really happy to say I've already gotten a check. Thank you, Mr. Zimmerman, for being the first check in the door for board giving. I had to work for it. Let me just say it wasn't an easy ask. I had to work for it. But I really appreciate that show of support. So you do have a pledge form. Feel free to fill, if you want to fill that out and turn it in, if you want to call me and talk further. But I would love to be able in November, when we launch our employee and physician campaign, to say we have 100% board giving from the board level, because we know that people follow leaders and people will follow when people give. So that's my request of you today, to kind of kick off our partnership. You'll learn I don't mind asking, because if you don't ask, you don't get. And I think it was appropriate for y'all to be my first ask of supporting JPS and what we do. I'm excited. The potential is huge. I look forward to working with you. I'm excited if you can't tell, but let's do great things together. I'm open for any questions or checks, either one. I'll take either or both.
Roger.
Carol, I don't have any checks, but I'll be happy to give.
Yeah. Thank you.
In line with, as I have before with North Texas Giving Day. Thank you for the report. And you have, 10 short-term initiatives and 7 KPIs, and that's a lot of information, especially for a young, I won't say established, but a very young organization. Fast forwarding to when you come ask us for money next year, which of these initiatives and these KPIs are the most important that you can say we were successful because of this, this, and this?
I don't think it will be one, but if it's one thing that we will be successful that will move the needle, it's going to be major gifts. It's going to be sitting down one-on-one and talking to people and telling them the JPS story and getting a gift. So when we build that pipeline, we're going to be sitting down, and the request you'll get from me next is going to be, who do you know that I need to be sitting down talking to? We've got to get, my major gift officer is my next big hire, and we'll get a major gift officer in, and it's going to be that one-on-one asking. There's no shortcut. There's no shortcut to asking and having that FaceTime and one-on-one. So that's going to be really important. We do have to build the pipeline, and so I think the next thing will be the direct mail. That's a soft way to build the pipeline, but it's also effective, and we'll start looking at addresses and targeted audiences and building campaigns around that to build the pipeline. Our shortfall right now is we don't have a pipeline. We just don't have that pipeline, so we need to spend a lot of time doing that. I think it will be a year. You're right. When we come back, we'll have the data to look at donor retention. That to me is really important. Like sales or anything else, it's much easier to retain a donor than to go get a new donor. So we're going to be spending a lot of time on the donors we have and steward them appropriately so we can keep them. That answer that?
Yeah. Thank you.
Any other questions? Thank you, Cheryl.
All right. Thank you.
All right. Next on the agenda is our consent agenda. Are there any items we need to remove from the consent agenda? There being none, I'll entertain a motion for the approval of the consent agenda. Okay. Second by Ralph.
He was talking, so I didn't get.
No, he was second. It was Zim. Zim. Mm-hmm. Okay. All those in favor of approval of the consent agenda signify by saying aye. Aye. Those opposed by nay. Motion is approved. Okay. All right. Did you have anything in open session?
Nothing in open.
Okay. All right. Then now we will reconvene in closed session. And we will close the open session, and we will immediately go into closed session. So I that we need to do. One is the privileges. So can I get a motion to okay, it's first by Steve, second by Steve. All those in favor of approval of the privilege signify by aye. Aye. All those opposed by nay. Motion passes unanimous. Now, for us, I have called a special committee entitled the Compensation Committee to review information about the GIBA and other defined benefit plans, and to review information regarding executive compensation pay. And I have appointed the following board members, DT, Roger, Zim, Ralph, to serve on that committee. And myself, sorry. And now we are asking for the board to consider approval for a request to fund the GIBA in the amount up to $1 million to cover any immediate payment that might need to be paid from the GIBA account until we have a full and final decision regarding the plan. Okay? There is no further deliberation on this matter, so I will entertain a motion for. Okay? All right. DT, Roger. Are there any questions? All right. All those in favor signify by saying aye. Aye. Okay. All those opposed by nay. Motion passes unanimously. We do not have any additional business, so therefore we are adjourned.